Okay, I think I think I've got it. I think I figured it out. My brain fog is starting to clear. My COVID brain is. Imagine that, man. Get through the whole pandemic, the scamdemic. No, not a scratch. And then when they end the damn thing, I get COVID. Imagine how lucky you got to be for that to happen. And I don't even know how I got it. It's either my brother or my friend because I don't go anywhere. Man, don't get it. Okay. It's not fun. Oh yeah, here's where we ended, and I was saying,
social service agencies. So they're not just
shut up, John. I was saying, this is the problem with the USA Today right here. This is who this idiot, Mister Inclusion, Equity, Diversity, Transparency, Honesty, blah blah. You know, he's got 20 titles behind his name, 300,000 a year, I'm sure. And what good is his office? None really, none.
just talking about communities, they serve communities. They provide behavioral health
Oh,
services. They provide housing services. They provide resources for trans.
yeah, yeah, they do. They're all called poverty pimps. Wait a minute, what happened? Oh, too bad. Oh, they had to go. Oh boy. All right, I'm sorry about that. But I wanted to show you something on my timeline here because we're talking about diversity and equity, and let me show you. Okay, here it is. Today I spoke with someone who is extremely senior within the NHS nationally. They stated that diversity managers increase NHS efficiency. They stated that diversity managers increase NHS efficiency. I asked how. Do they positively influence patient outcomes? They then said they weren't going to have this conversation and walked off. Maybe you should have added some context to the conversation. The person you were talking to was me, your brother, and at a family funeral. I walked away because I didn't want to engage your small minded opinions. Yeah, well, see, this is exactly the kind of response you would get from a diversity manager right there. There's no point in a diversity manager. It's a fraud.
Transit-dependent communities. And these were the folks who allowed us and worked with us to engage over 12,000 writers and stakeholders about how they'd like us to sort of rethink and reimagine public safety on the system.
See, this is just garbage, man. We engaged 12,000 stakeholders, whatever the hell that means, to reimagine public. They haven't done anything with safety. They have bands of all these different people wandering around in packs, and meanwhile, it's just as unsafe as ever. Okay, we're not noticing any safety change. So they didn't do anything. This is all smoke and mirrors. All of this is smoke and mirrors.
Next slide. And so we took that feedback, both what we heard from surveys, what we heard from
See,
interviews
this is
across.
what this guy does. He's going to be doing this for a job. He's going to go to these fucking agencies that don't, poverty pimp agencies. He's going to ask them questions. Then he's going to do studies. I mean, this is bureaucracy. This is ridiculous.
Multiple languages, and our research that we conducted around the country of who's doing public safety right. Where can we learn from what's happened in the past? And those 300 pages or so we brought together across multiple reports, and we, again, tabled a group of local leaders working in the space.
Oh, local leaders. I'm sure they know what's going on, right? Beverly Scott, she knows. It's hilarious. You got to get a kick out of this stuff. Look, a CI. Look, he's got his hand up. Maybe that's a Heil Hitler. No, he just got his hand raised. Oh, God.
to help us come up with a series of recommendations that would help us rethink and reimagine public safety on the system. And all that led to a pool of opportunities for Director Wilson to move forward on.
Yeah, a pool of baloney for the other guy. So here we have bureaucrats gone wild, ladies and gentlemen. I hope the sound's coming out. I think the sound's coming out right.
Well, I want to say this, and I know that John doesn't necessarily want me to say this, but John did a really Herculean effort in stewarding this process. And
Yeah, here we go. Let's do the hero worship. Yes, here we go. They all suck each other's dicks. We know how that. We know how they do this. This is part of the bureaucrats. This little club of bureaucrats. This is how they do it, man. They all fucking they all pat each other on the back and say how great they are because we are the greatest bunch of people I've ever heard in my.
in the very beginning phases in particular. And it wasn't just John, it was an entire team of folks. I think of Amparo being a part of our eventual Reimagine Public Safety Committee that we established. If you could go to the next slide too, please. And also teeing it up for some really good activity and discussions about how we can actually march forward with these 24 community-driven initiatives. And so,
These 24 community-driven initiatives, ladies and gentlemen. Oh my God, this is rich, isn't it?
I want to thank Dr. Lewis, who stepped into that process and helped us chair that committee. She did an amazing job of just helping us all have honest conversations and get transparent feedback from community in terms of how we were trying to execute on these 24 programs. And of course, John was a part of that committee too. So thanks, John. He hates it when I do that. No, but so we got 5 focus areas that we identified out of those community-driven initiatives. And I'll say that today...
Look at this nonsense. Will you look? This is fucking ridiculous. What you need is people standing there. You need actual physical people providing security. You don't need this. You need people stationed at busy transit centers at all times. Armed or unarmed, preferably armed. Okay? Not checking fares, but doing security.
What I'm going to be providing to you is an overview of a couple of the standout pieces of these 5 different focus areas. You all in your board portal have a white paper on Reimagine. Dr. Lewis and the entire group that did work with us on this, which represented lots of different community groups who spent many hours with us working through this. We had a monthly meeting.
Many hours sitting around a table with John and Dan or whatever his name is and yakking away about nothing.
But there was reading besides. There was other meetings outside of that.
Yeah,
so really big thanks to the community coming together to sort of help us through these initiatives. What I'm going to be giving you is an overview, because to go through every 24 of them would be...
I'm going to start playing calls in a minute here if you want to start pretending how hard you've had it. You're
quite exhausted, but you do have a white paper. So I'll just kind of go from there. So next slide, please. So these are some of the members that were a part of that implementation committee. And this is the group membership that Dr. Lewis, I, and John sort of led through as we discussed.
Look at them. All the poverty, ATU's in there. When we know ITU, I guess Opal's become a little more active. They just disappeared on me, man. Urban League, Jesus. These places are all poverty pimps.
These 24 initiatives and how
they all have their little cute logos. I mean, it's just sickening, man. Notice how every one of them has a specially made logo. Look, that's our society now. Everything is a brand.
Accomplishing them. Next slide, please. Out of those, we came up with 3 primary objectives that we've been focusing on, and this is why you've heard me talk about these a lot as we've gone through this year. Training. I'll talk about that a little bit more. We've done a tremendous amount of additional training at this agency, necessary training, not only for security staff, but also for frontline staff, and we are planning to do more. So, and this is an anti-racism, culture of humility, mental health, and de-escalation. Lots of de-escalation activity has been going on with our primarily unarmed security that's been increased since Reimagine. So increased presence, the next, you've heard me talk about this. Out of these recommendations, we've developed some very good teams from an unarmed security response that are reflective of the community, and I'll spend a little bit more time on that as we go on. And then also crisis intervention. How are we dealing with those in mental health crisis or with behavioral issues? We see it all around us in our community, so how are we at Trimet utilizing the recommendations we heard to sort of make a Trimet effort that tackles those issues? So next slide, please. So on training, we have a list of 34 awareness classes on culture, race, gender, justice, and bias for Trimet employees. Be happy to sort of review those with you. And I'll say this is 34 at this point. This is a training in our new era is going to be something that we are going to be focused on for time immemorial. And I do think that there's just great investments that come out of that have already come out of that for frontline staff. So this is a key area for us, and we continue to work on that based on the recommendations we received from the committee. Next slide, please. System presence. You've seen the increase in unarmed personnel trained in de-escalation techniques. We've talked about.
I don't know. I hear a lot. I don't know if you can rein in the collapse of civilization, folks. Okay, I mean, we're seeing all of it. It's all right there for you to see if you want to look. Most people don't want to look. I don't know what you can do about being in the middle of a collapsing civilization. You know, these are elites in the middle of a collapsing civilization. I suppose I'm considered one too. No, not now. I'll have to get back to you.
About that a lot, so I won't spend a lot of time on that today, but just know that this is a recommendation out of that committee. We've also implemented a safety response team. I'm going to spend a little time on the safety response team, a couple slides, because I want to kind of also talk about some segues and nexus that they have with some other work that we've had here at the agency. But, they are reflective of the community. They're trained in crisis response. I brought some of their safety response here last year. I think you guys were able to meet them. And I'm going to talk about another opportunity for you to meet with those folks at the end of the presentation. So next slide, please. This is just a brief overview. We have this dashboard available if anybody wants to know in terms of where we're at from staffing. You can kind of see the journey we've been on. And again, you'll notice that blue line at the bottom, transit police is held flat. We do want to rebuild our transit police, and we're dedicated to that. But with down law enforcement and where we're at, we've been increasing in the unarmed presence. And I'll say that this was a direct recommendation out of Reimagine, and it's actually put us in a much better place at this point in time to deal with some of the issues that are out there. So. But this is kind of where we're at this point. Next slide, please. This is actual versus budgeted staffing. Again, these dashboards are available to you if you want to look into that further. Next slide, please. So this is our safety response team. You know, their blue and yellow uniforms are out there. There's actually 49 as of today on the system. We're moving towards 60 of these folks. You remember we started with 8 in September of 21 as a pilot. This has grown.
I don't know,
I'm
man.
sharing this model with other transit agencies, with...
we don't want to hear about your model with other transit. 48 people from diverse backgrounds. Are there 48 people that can do the damn job? It's not that many people for a system the size of Trimet. What, you got 600 buses and 200 trains or something? I mean, that's not even 0.25 person per vehicle.
Other agencies in the city of Portland, it's going very well. And I'll say that this group fulfills a lot of the same work that we used to see from the transit ambassadors. You'll hear about people talking about transit ambassadors. We actually did a crosswalk in our Reimagine group and kind of showed what the transit ambassador program did versus the safety response team. And what we came up with is the safety response team does a lot more than the transit ambassadors. Obviously with the de-escalation training, the mental health training, crisis response, those types of things. The Transit Ambassador Program didn't delve into some of those areas. And so this is a really effective group, and it's fulfilling a need on the system. So we'll keep going to the next, please. Just some additional information again about what this group accomplishes for us out on the system. I have lots of data points regarding the outreach that this group has been able to accomplish, how they've made connections. And we're continuing to track that because we're trying to get better at how we reach folks on our system with the SRT. So We've got various very, very good stories I could go into, but I won't talk about those today, but grab me after, I'll tell you some. Next slide, please. So another area, technology, and we spent a little time on this morning, even with discussing the access control and some of the SEPTED initiatives we have regarding our elevators. But the idea is how do we use technology really to impact our community and create safer outcomes? And so one of the areas that we're doing is software to track security incidents and customer experience, to be able to have data points available to steer better. When we're also investing in real-time incident reporting tools for employees and for riders. So look for that next year. You're going to start having the ability as a rider to be able to connect directly with security team personnel on a 24-hour basis, which is something that's very necessary and our community's asked for. So just a couple technology. And remember, we're all just doing it 2 because we don't have all the time to go through all 24. But infrastructure-wise, again, this comes back to a lot of SEPTED upgrades. We've done a lot of lighting upgrades. If you've seen out there, I've talked about this before, but Rose Quarter, Gresham Transit Center, Gateway, really focused on upgrading lighting as well as surveillance. And this kind of goes into that crime prevention through environmental design. If you've been to the Gresham Transit Center recently, you'll notice that we've cut down the shrubs, we've improved the lighting, we've improved surveillance. So there's just a lot of good activity happening from a SEPTED principle on some of the areas we know are impacted the most. So, and that's one area for infrastructure. And next. So the last sort of thing is, how do we communicate with our community that we're interacting with? How do we get feedback?
Listen to this. Implement a quarterly reporting of safety and security. It's ridiculous. To develop a rider club survey. This is their little, their little deep state thing. They get you to sign up for their thing, and they can report you to the deep state.
How do we continue this process? We're implementing a quarterly reporting of safety and security on the system as part of the general board briefings. We actually vetted the kind of items that we'll be reporting out on with this committee. They helped us build that report. So we're going to be doing that on a quarterly basis for you. We're also developing a Rider Club survey, which I think John will be involved in later part of this year, but just to get direct feedback. We talked a little bit about that earlier in terms of how are we getting feedback, and we really want to know how the tools that we've utilized and developed on the system are being felt, and we need that feedback. So we're going to be doing that, and you all will have access to that as well. So next slide. So next steps, we have an open house with the safety response team for all of the members of the Reimagined Public Safety Committee. It's going to be at our public safety office. The safety response team and their leadership will be there. You all will be invited May 23rd, so look for that. We'd love to have you out to interact with some of those folks. The Rider Club survey, which I already mentioned, and continual safety and security updates with the community. And this is something we're leaning into heavily too, is how do we kind of communicate back and share those meetings to have that open and honest conversation back and forth with community. So, and those are some items there. So next slide, I think we are to questions, and I wanted to open that up for John or I.
Director Way. Thank you for the presentation and update. If you can, I don't know if you can go back to the technology software slide, but I kind of want to focus on this. So, over the last couple of years that I've been on the board, there's just been very heartbreaking, horrific, sometimes tragic incidents on our system. And so I guess my question, because this is part of safety and then looks like there's some upgrades, do you think this will prevent any of those incidents from happening?
No.
For example, if we're able to see a guy with a knife on our surveillance video, is this going to help with getting folks like that off our system? I'm just trying to understand the additional surveillance piece.
Yeah, no, it's great.
Safety and how are we improving safety?
Thank you, Director Way. The technology is one piece of how we achieve safety, but it's a very important piece, and I think it's an increasingly important piece. And I'll tell you a couple examples. So we have now over 8,500.
No, it's not. You need people on the ground. People on the ground, riding the trains, sitting in the stations. Wrong. Why do they have to keep diffusing what's actually necessary with this nonsense?
cameras on the system. I mentioned that briefly during the TSCC meeting, but I'll tell you that we also have a surveillance team that monitors those, right? But right now, we don't have a 24-hour capability for monitoring. A lot of times we're doing kind of responsive actions where people will say, can you get me some surveillance on something that happened at a different area? Where we're moving towards is having that 24-hour security desk capability, where we actually have people that are monitoring certain areas that are able to be available for a call immediately from a potential rider with some of these rider reporting tools as well. So what we're trying to do is get to a point where we can utilize technology better for those types of incidents. I'll give you some other examples. Often now, before we send a team out to look at a platform or whatever, we'll pull it up on surveillance. We'll be able to review the whole situation and be able to direct the right resource to that situation. It might be SRT, because we might see some folks that need some sort of outreach surfaces and that sort of thing. So we're being more strategic with the resources we have based on technology. But, access control is another key piece to that as well. This pilot at Hollywood Elevator, we'll see how that goes. It's a pilot for a reason. We really do want to try to understand how that impacts. But so far, limiting like interactions in elevators to those that are actually riders is a good outcome.
Yeah, you could actually have a security guard there, provide a job for somebody, and keep the riffraff out of there. I mean, how complicated is that? I mean, why can't you do something simple like that? Give somebody a job. Make the elevator secure.
For us. And so we're trying to kind of explore how we can utilize technology in that space too, if that makes sense.
Thank you. I think, that's helpful, and providing those examples, I think, is a better way for me to sort of understand this on the ground. And, I think I do like the example that you used, Andrew, about when we're able to, access our cameras and our, the surveillance, I guess, more around the clock, then we can also hopefully have the proper response, the proper incident response. So, for example, there's a lot of folks that are houseless in our communities that are accessing, transit for just shelter sometimes, or just to sleep on something. And so, like as one board member, just speaking for myself, like I wouldn't want an entire police force to stop a person who's houseless from bringing in all their belongings and wanting to sleep on the max, for example. So I just use that specific example of hopefully whatever people are seeing on their other side of the camera, we can bring our safety people, right, who are unarmed, for example, with a mental health counselor, with whoever else that various counties are providing for that wraparound response to respond to those particular incidences. So
Good.
I just wanted to make that comment and be clear that we are trying to use public dollars wisely and in a specific way to help serve the public, but also keep everyone safe.
Yeah, great comments.
Director Edwards.
Thank you. And thank you and John for your report. I had a question along those same lines. Trimet does not operate in a bubble. And so we're affected by...
Well, actually, you do operate in a bubble because you're not affected by city, state, federal rules. You're your own country. So you do kind of operate in a bubble there, old Director, Mr. Edwards.
influences that are outside of our control. And so my question is, we have adjacent properties that are owned by the government or other entities throughout the system. What kind of cooperation and support are we getting from those other agencies to help us make sure that we have a secure and safe system?
Yeah, it's a great question, Director Edwards. Where we're at with that, and I'll tell you, there's a lot of...
Yeah. Yes, it is.